Hello and welcome to Primary Care Today on ReachMD. I'm your host, Dr. Brian McDonough, and with me is Dr. Kimberly Richter. She is professor at the University of Kansas Medical Center, and she caught my attention in an article that she had in New England Journal of Medicine where she talked about big marijuana, lessons from big tobacco. I like the way she started. She said the United States is divided over the legalization of marijuana. Arguments in favor include protection of individual rights, elimination of criminal sentencings for minor offenses, collection of tax revenue, and elimination of the black market. Counter-arguments include possible escalation of use, adverse mental and physical health effects, and potential medical and social costs. So first of all, Dr. Richter, welcome to the program.
Oh, thanks for having me.
My first question for you is, you wrote a very long editorial, a very interesting editorial. Maybe your words better than mine. You can summarize the points you were making.
Well, Dr. Sharon Levi and I were both really concerned about the fact that people focused on the current harms of marijuana when folks were thinking about whether to legalize or not, but didn't think about the kind of transformative effects that an industry would have. So I guess, when I think about what marijuana could mean as a consumer product, I just feel like legalizing it and creating an industry would, create a moving target. And nobody was really talking about how marijuana and its products are a real moving target. And so I wanted to point that out, and just sort of based on my experience with tobacco.
Tell me a little bit when you mean moving target. What are you saying?
Well, the content of marijuana itself is changing. The potency of strains that are available now are much stronger than they were in the past. And also the kinds of products that are being marketed that contain marijuana and constituents of marijuana are changing. And I think that this can be accelerated if marijuana becomes legalized and the sales of marijuana increase. So there's that much more research and development money for marijuana producers. So it's changing all the time, and it's really hard to get a bead on what are its effects, how harmful is it, because it's changing.
You talk about, in the fact the title is Big Marijuana, Lessons from Big Tobacco. What have we learned from big tobacco from your perspective? And clearly you're an expert who deals in this field. What have we learned about, at least from a medical standpoint, the dangers and concerns first?
Well, with tobacco, we know that when people started using it, it was sort of very different from the industrialized cigarettes that we use today. So we know that different strains were introduced and different ways of preparing it were created to increase its addiction potential without really any regard for its safety. And so that's one fear about, what could happen with marijuana if it became legalized and corporate America swung behind improving it as a consumer product. Also, tobacco is very dependence forming, and that dependence potential changed over time too. And although marijuana appears to be less dependence forming, maybe a third lower proportion of people might become addicted to marijuana when they use it than tobacco. That's the marijuana of maybe 20 years ago, or the current marijuana, not the marijuana that's being developed in the states where it's been legalized. So I guess the fact that we've seen tobacco be transformed and become more addictive and more harmful makes me think that this is, quite possible for marijuana.
From what we've seen in the world of tobacco, if they did the same things with marijuana, it could be devastating, clearly, because, and you're right, from a perspective of looking ahead of time. I think most of us, including myself, that's why I found this so fascinating. Mm-hmm. I'm looking at it as, oh my gosh, is marijuana going to, turn a generation into drug abusers? Is marijuana going to do this, do that? I'm thinking in 1980s, 1970s terms, not somebody taking it, changing it, modifying it, and trying to really monetize the use of it.
Yeah, exactly. And also, if it becomes legalized, then there'll be, advocacy groups that will spring up. They've already been created to protect the corporate interests of the marijuana industry. And that means that big money can get into politics. And we've seen recently a real sort of rolling back of regulation over money in politics. And so, for anything, but that'll apply to marijuana money, protecting marijuana corporate interests as well. So although we could say that, well, we can legalize it, and then if it gets to be a problem, maybe we can introduce some laws and stuff like that. But once the horse is out of the barn and once there are big lobbying interests sort of pounding on the doors of legislators, then it's going to be harder to address some issues that might come out after, we've seen the effects of these newer products.
If you're just tuning in, you're listening to Primary Care Today on ReachMD. I'm Dr. Brian McDonough, your host. I am speaking with Dr. Kimberly Richter. She's from the University of Kansas Medical Center. She joined with Dr. Sharon Levy to write an article in the New England Journal of Medicine, Big Marijuana, Lessons from Big Tobacco. Tell me what responses you have received thus far. Obviously, I'm sure I'm not the only person who read it and noticed that it was fascinated by what you had to say.
Well, I've heard from a number of folks that they hadn't really thought about marijuana as a moving target, and when they were balancing the harms of marijuana versus the benefits or maybe the reduced harms of making it legal, that is, correcting some of the longstanding problems with criminal enforcement of drug laws, they thought, marijuana is just not that harmful. What's the big deal? But then they hadn't thought of marijuana as a moving target and as the industry as a real catalyst for change. So a lot of people, thanked me and thought that it pointed out something that sort of needed to be addressed in thinking about marijuana policy. A lot of other folks have sort of said, this is knee-jerk, prohibitionist advocates, coming out with more arguments about, why we need to keep marijuana illegal. And I was a tiny bit disappointed in that because, really I hope to point out the fact that we just need to think really carefully about how marijuana can change, not the marijuana from 10 years ago or 20 years ago, but what is the marijuana of today and what is the industry going to do with it? And I think anybody ought to be thinking hard about that.
Our program, of course, reaches out to physicians, particularly primary care physicians, healthcare providers. And what about marijuana as a tool to help in various illnesses? And what about addictive potential? I know you mentioned in your report about 9% of cannabis users meet the criteria for dependence. But tell me a little bit about the dependence and also where it could be helpful as a tool with it being legalized.
Well, it's 9%, but of all folks who report they have ever used marijuana also report that they have been dependent on marijuana, and that's according to kind of large epidemiological studies. But that's 9% of everybody. When you look at youth who have tried it, they become much more likely to become dependent on it. And so, or people who tried marijuana when they were still young have a much higher addiction potential. So I guess I think the danger in the addiction potential of marijuana is, A, that it's changing, so we don't really know what these innovations are going to do to its dependence potential. In terms of its benefits, there are some reviews coming out that suggest that it has some health benefits, but there aren't that many studies, in part because it's difficult to do research on the health effects of marijuana because the way it's scheduled right now. And I really believe that we do need more research on the potential health benefits of marijuana, and we really need to open that door up because we shouldn't throw any babies out with any bathwater. We should look at the beneficial effects of any medication or any drug, any medication that can be derived from natural components. But right now, there's very little research on the health benefits, and we need to strengthen that.
One of the things that you wrote that concerned me, as a physician, was you talked about how there's new vaporizer delivery systems developed by some manufacturers that could reduce lung irritation from smoking, but also could allow users to consume more THC, and that, of course, is the component most closely associated with euphoria, addictive potential, and the mental health side effects.
Yeah. I mean, the thing is that right now, marijuana, in any of the way that it's it's being packaged for consumption. It's not medicine. Medicine adheres to very strict standards, protocols of how it's processed and how it's packaged and its potency, so that when anyone takes a prescription medicine, they know what they're getting. And right now, smoked marijuana or marijuana that's been, developed and produced by independent for-profit companies without any oversight, it's sort of the Wild West out there, and you have no idea what's in there. And so, even in states where it's legal for medicinal purposes, you really don't know what you're getting when you're using it. And I think that's the frustrating thing for physicians. I know in Canada there are proposals to have physicians be the gatekeepers for medical marijuana, and that people, or for any use of marijuana, so that people can go to their doctor and talk to their doctor. But doctors don't know what people are getting, because one joint of marijuana or one strain is one strain, and you have there's no standardization.
Right, and I would think also most of us, to a large extent, weren't taught about it. There'd be a lot of education we'd have to understand.
Exactly, and I mean the education around alcohol, around tobacco, is really, really terrible right now in medical schools and any schools of health. It's very, very minimal, even sort of given the tremendous harms that come from both of those substances. And how in the world are we going to get these already beleaguered educational programs that are trying to teach so many things to provide balanced information about marijuana? Who knows how that's going to happen.
We only have a couple more minutes left with Dr. Kimberly Richter, and I wanted to ask you also, I know you have a great deal of experience. In fact, probably a lot of the interest you have in marijuana stems from your work with tobacco, cigarette smoking, and smoking cessation. Where are we right now in our battle against cigarettes? I mean, this has been going on for so long, and yet we make a stride forward, a stride back. Where are we as a country because of all the disastrous health effects as a result of smoking?
Well, it's so funny. People, and I've been working in Brazil for the last 6 weeks, and, in the U.S. we have a real mixed bag. We have national guidelines around tobacco treatment, but we have not ratified the international treaty on the Framework Convention on Tobacco Control. So we really haven't gotten on board with the other 180 or so countries in the world that have said, here is how we're going to deal with marijuana on an international basis. So we haven't sort of jumped on board with that. We've been the home for a lot of the research for new treatments for tobacco use, but still a lot of people don't have access to those treatments. The Affordable Care Act has opened up coverage for people on Medicaid, which is wonderful, and also people with private insurance. There are new mandates for covering tobacco treatment medications and counseling, but it's not uniform, and it seems so crazy because these medications, when you look at them compared to the cost of treating the health effects of tobacco, are nothing. And yet we haven't really put our money where our mouths are and said, look, we're going to make access to treatment. We're going to make it as easy as possible for you to quit. So that's kind of frustrating. We don't yet have a national clean indoor air policy. We have, roughly half of our states have that. So we've got a long way to go there. So, I'd say we're doing well, and things are looking up for treatment because of the Affordable Care Act, but we have a long way to go.
At the time we're recording this program, we're in the midst of the World Cup. You just got back from Brazil. Did you get a chance to see any soccer?
I sure did. I went to, it wasn't a key game, but it was the game that we could get into in Brasilia, Switzerland against Ecuador. My granddad was Swiss, so I decided to plunk for the Swiss, and they won, and it was wonderful. And Brazil actually, they kind of have they have a wonderful tobacco control program there, and they've made a lot of strides in areas where we haven't. And then areas where we've excelled, they're really struggling with. So it's really great not only to go to another country to see the soccer, but also it helps understand, where we are here in the country, in the U.S.
Well, the sharing of the ideas is so important, and it's really great you're doing this work. And Dr. Kimberly Richter, I want to thank you for joining us on Primary Care today. I really appreciate you taking your time.
Oh, yeah, thanks for having me.
This is Dr. Brian McDonough. If you missed any of this discussion, please visit reachmd.com/primary care today to download the podcast and learn more about the series. Thank you very much for listening.